Did you know that it can take up to 13 years for some women to get correctly diagnosed with PCOS? Over 50% of women with PCOS report that it negatively affects their work, with some even missing work due to symptoms. In India, the number of PCOS cases is on the rise, so I had to make this video. This video will explain everything about this condition. Let's get started. Now, PCOS is a hormonal disorder that affects up to 10% of the women of reproductive age. Between 1990 and 2019, the incidence of PCOS increased globally by 54%, with the highest rates among teenagers aged 15 to 19. This condition involves irregular menstrual cycles, excess androgen levels, and polycystic ovaries, leading to symptoms like acne, hair loss, difficulty with weight management. It can also increase the risk of serious health issues like diabetes, heart disease, infertility, and even depression. PCOS is one of the leading causes of infertility and is responsible for 70% of the cases of anovulatory infertility. There are several common misconceptions about PCOS. First, it's not just a reproductive disorder, it's a complex endocrine disorder that can also impact metabolic and psychological health. For example, 37% of women with PCOS experience depression compared to 14.2% of those without PCOS. Another myth is that all women with PCOS are overweight. While weight gain is common due to insulin resistance and hormonal imbalance, lean women can also have PCOS. Some believe that PCOS goes away after menopause, although some symptoms like irregular periods may naturally resolve. The underlying metabolic and hormonal imbalances can still persist. And no, birth control pills do not cure PCOS. They help regulate the menstrual cycles and reduce androgen levels, but the underlying hormonal imbalance actually remains. Lifestyle changes and other treatments are often needed to manage the condition comprehensively. Women with PCOS face several challenges. Diagnostic delays are common, with an average delay of over 4 years. Up to 52% of women report receiving insufficient information from their healthcare providers, and about 70% feel dismissed or not listened to by their doctors. Many general practitioners lack the necessary training to diagnose and manage PCOS effectively, leading to dissatisfaction among patients. Now listen in closely. Apart from the usual symptoms of PCOS such as irregular menstrual cycles, excess androgen levels, polycystic ovaries, insulin resistance, weight gain, acne, thinning of hair on the scalp, there are other symptoms that you might not be aware of. And these are darkening of the skin, particularly in the areas like the neck, groin, or underarms. Watch for this. The other symptom could be pelvic pains, which can be irregular or less directly related to the menstrual cycle. Headaches or migraines linked to hormonal imbalances, they're quite common. Sleep apnea or snoring, and this disturbs your sleep, especially in the women who are overweight or have insulin resistance. Dry or flaky skin due to hormonal changes is huge. Digestive issues like bloating or irregular bowel movements potentially related to insulin resistance or other metabolic changes is often seen. Now, traditional medicine often focuses on managing the symptoms of PCOS through medication or surgical interventions. However, holistic aspects are sometimes overlooked. I would like to mention some points I think that we all know about them, but we do not practice them thoroughly. First one, stress management. Techniques like mindfulness, yoga, meditation, and relaxation exercises can really help you manage your stress and improve your overall well-being. Actionable steps will be waking up a little early, starting with 30 minutes, and with time, build consistency, which will help you in your breath work, yoga, meditation, or any exercise which can be scaled up to 1 hour. By the way, if you don't know where to start, I've pasted a link to my favorite guided breathwork videos. The link is in the description below. Tune in and kickstart to your day. But to rise early, you need to sleep well, which brings me to my second point. Sleep quality. Poor sleep can negatively impact hormonal balance and insulin sensitivity. Ensuring good sleep hygiene and addressing any sleep orders that can support overall health and symptom management. So what do? Go easy on your dinner and finish it off 3 hours prior. After that, don't use too much of a screen with blue light, TV. Go easy, wind down, read a book, some calming music, warm lights, mild hot showers, read a nice fictional book. This will help you sleep or get sleepy faster. You know what? Even herbal and complementary therapies may work. Some herbal supplements and complementary therapies like spearmint tea for reducing excess hair growth or even acupuncture for hormonal balance may offer additional support. Gut health. The health of the gut microbiome can influence inflammation and hormonal balance. So eat foods that support your gut health. What works for me doesn't work for you, so your gut needs a personalized diet. Now I practice at the Qua Nutrition Clinics where we do needful tests like microbiome testing, food intolerance testing, genetic testing, and even the normal blood test before we plan the diet. So to get yours, there's a link to a Google form in my description below. Please fill it out and my team can get back to you the earliest. Now, PCOS can be presented in different phenotypes, including hyperandrogenic, ovulatory, non-ovulatory, and mild. Understanding that not all individuals with PCOS have the same symptoms helps in tailoring treatment and avoiding a one-size-fits-all approach. In conclusion, PCOS is not just a reproductive disorder, but also influences your metabolic and psychological health. Women with PCOS are at a risk of being diagnosed very late or misdiagnosed due to a knowledge gap among practitioners. Besides the usual symptoms, PCOS can also lead to skin darkening, pelvic pains, and problems like sleep apnea. Therefore, I believe managing diet and exercising are the most common methods of managing PCOS, but methods such as mental health management, sleep hygiene maintenance, and herbal therapies are often overlooked. PCOS can manifest in different ways in different people, so it's important to get a full body checkup once in a while to help in early diagnosis and the management of the disease. So if you're someone who has been diagnosed with PCOS, tell us your story of how you first found out about it in the comments section below. We'd love to hear from you. Thanks for watching. If you found this video helpful, please give it a thumbs up or subscribe to my channel and hit the bell icon to get notified whenever we post a new video. Your love, your share, your subscription makes me want to work harder for you every time. So take care and see you next time.